Dear ladies and gentlemen, welcome to my quick oral presentation on the topic nutritional status of people with dementia in the domestic environment. My name is Christina Nutritional and I'm a researcher at the Interdisciplinary Center for Health Technology Assessment and Public Health at the University of Erlangen-Nuremberg in Germany. First, I'd like to briefly give you an overview of the Bavarian Dementia Survey. Subsequently, I will present you my research project. The Healthcare Research Project, Bavarian Dementia Survey, or BIDEM for short, was funded by the Bavarian State Ministry of Health and Care and had a project duration from February 2015 to December 2018. The aim of BIDEM was to improve the care situation in the home environment of people with dementia and their caregivers. For this purpose, data were collected over a longer period of time in order to be able to map the course of the disease as well as changes in the care situation. Participants of the project were both people with dementia and their caring relatives, who were interviewed by various trained cooperation partners in the home environment. Cooperation partners were different institutions, ranging from doctors' offices to outpatient care services. An important inclusion criterion was that the patient had to be diagnosed with dementia and still had to live in their home environment at baseline. BIDEM was a multi-center research project conducted at 3 sites in Bavaria with different population development. The nutritional status of the people with dementia was assessed using the body mass index, or BMI, according to the cutoff values described by the World Health Organization. Malnutrition was age-adapted according to the consensus statement of the European Society for Clinical Nutrition and Metabolism with a BMI less 20 kilograms per square meters cutoff value. The left graph shows that at baseline, 12% of the 245 people with dementia who could be included in this analysis had a BMI below 20. At the 6-month follow-up, 10% of the 182 people with dementia were affected by malnutrition. The 12-month follow-up, malnutrition also affected 10% of 128 people with dementia. Among women, 70% had a malnutrition at baseline. Among men, the proportion was 5%. Post-hoc test shows that this difference was significant. The percent of appetite and eating disorders could be evaluated using appropriate questions of the survey instrument neuropsychiatric inventory. According to the caregivers, 32% of people with dementia had a change in appetite, weight, or eating habits at baseline. The prevalence of malnutrition in people with dementia in the home environment is less well researched and is lower compared to other settings. Nevertheless, analyses indicate in Alzheimer's disease the data vary from 0 to 30%, and a remarkable 14 to 80% of this considered population is at risk for malnutrition. Thus, the percentage results that 1 in 10 persons with dementia in the home environment is affected by malnutrition can be placed in this range. Because there are very few analyses of malnutrition in the home setting, and most of these have been cross-sectional, one strand of this analysis is that it was possible to conduct a longitudinal analysis. In this context, it should be critically discussed that people with dementia living alone were not represented. However, those living alone have an increased risk of developing malnutrition. Another limiting factor is that body weight was inquired from the people with dementia in the direct assistance of their caregivers. I would like to thank you very much for your attention. You're welcome to contact me via the pasted email address.